thank organs for giving this opportunity, especially Kumar sir and Akshay sir. So today we are going to discuss regarding which was then taught in 2021 WSLC, lurbinectedin and doxorubicin versus treatment of physician choice B Tepotinib or CAB in relapsed small cell lung cancer patients, which is a phase 3 randomized trial, Atlantis trial. It was discussed in 2021 from 2021 and the recent publication I am going to discuss in detail a little bit. Next slide. Excuse me. So, just a background.
Dr. Kripa, is this your presentation for this session or the subsequent session?
I mean, only one presentation I have. The small cell lung cancer session. I got this as a in my mail, sir.
Okay, yeah, please go ahead.
I'm sorry. So, in the background, small cell lung cancer, more than 2 million diagnosed in a year, which constitutes 13 to 15%, mostly in smokers. We know it's a very aggressive, though sensitive to CTRT, but it's a transient response got seen. The minimal therapeutic advances are there, and relapsed case survival is just 6 to 8 months. So, the second line treatment, like what is lurbinectedin? So, it's a second line treatment. So, it's a marin component is there. The single agent has shown a very good response rate. If you see the resistant versus sensitive, the platinum chemotherapy sensitive versus resistant. Sensitive is more than 90 days. So response rate is 45%, decent PFS got seen and control rates got seen. So single agent 3.2 mg per meter square approval was given by FDA. Later, phase 1B trial was done for the combination of lurbinectedin as well as doxorubicin. It has shown a very doubling of the response rates with a good disease control rate. So later the phase 3 trial, the Atlantis trial was done. The small cell lung cancer with one prior chemotherapy line. Additional one line of immunotherapy is also allowed in this one with a good performance status like less than or equal to 2 at least. And patients chemotherapy treatment free interval should be more than 30 days. Less than 30 days people got excluded. Again the stratification was done based on the days and duration. So the people patients got randomized to lurbinectedin plus doxorubicin versus treatment of physician choice. The treatment of physician choice ideally is a topotecan 1.5 mg/m² what we regularly use and CAV regimen in fit patients. So it was compared. So the primary endpoint is the OS, unacceptable toxicity, disease progression with the co-endpoints. Recently the follow-up data got analyzed in 2021 WSLC for the 24 months follow-up. The PFS was good enough, like the PFS if you see 5.9 versus 4.6 months. At 6 months 31.3% versus 24.4% and PFS percent at 12 months is 10.8 versus 4.4. We already discussed before the median survival is very less, it's only 6 to 8 months. It prevailed in respect of using any combination, but still there is slight PFS benefit got noted with hazard ratio of 0.83. So the OS absolutely bang on, not much difference is there, only 1 month difference is there. So everyone do talk it's significant, but definitely it's not significant. The hazard ratio is 0.967. If you see the curves, like even the chemotherapy free interval, what was discussed regarding lurbinectedin in the prior is when the chemotherapy treatment interval is like as the time passes, the patient will get a very good responses. We see 90 to 180 days, more than 180 days, not much erring towards the combination, and treatment of physician choice like remain almost equal and not much difference is there. And all the baseline stratification or later stratification got done, be it a CNS involvement or PDL1, absolutely there is no difference in the outcome. But what is interesting in this study in the Atlantis trial is when patients non-small cell lung cancer, most of them we do see they don't tolerate second line chemotherapy well with a lot of toxicities because post etopocarbo once patient got received those two drugs, most of the times we do see significant toxicities with lot of dose reductions. If you see lurbinectedin plus doxorubicin, there is a decent amount of less toxicity. If you see the grade 3 and more, significantly less anemia, neutropenia and febrile neutropenia got noted, and transcendent is all like it's very less. It's almost like comparable. But the hematological toxicities are quite less with lurbinectedin plus doxorubicin. So the conclusions about my study is Atlantis joins the rank of negative phase 3 studies in patients with recurrent small cell cancer. but in my view offers support for efficacy of lurbinectedin and small cell lung cancer. It demonstrates similar outcome with superior safety profile over the standard of care. Lurbinectedin offers a new platform on which to better build combination options will be more available. I thank the organizers for this opportunity again.